Come back. If you just tune in, the program is Health Options and the NTA, and we have been looking at effort by the government in strengthening healthcare in Nigeria in the last 2 years with the special assistant to the president on health, Dr. Salma Anas. Thank you for being there, ma'am. Now, we have had the achievement made thus far, but I'm sure they are without some challenges, however. Why are we still seeing persistent gaps such as doctors shortages, inadequate infrastructure, and even, unequal access to quality care, especially at the primary level?
So let me start by saying that one of the commitments of President Bola Ahmed Tinubu under the Renewed Hope Health Agenda is to ensure equity in delivery of healthcare services and attainment of universal healthcare coverage, leaving no one behind for all Nigerians, irrespective of your socio-economic status, irrespective of your gender, irrespective of your age. So it covers everybody across board. And the government has demonstrated commitment in doing that over the last 2 years. So, of course, the journey is not without challenges. There are challenges. And what you have raised about human resources for health is a huge challenge. Migration, not only of doctors, but healthcare providers, including nurses, midwives, laboratory scientists, pharmacists, they are all migrating. And this is a global phenomenon. It did not only affect Nigeria alone, but we have witnessed an increase in migration of healthcare providers in the last 5 years. So, for example, evidence have shown that in the last 5 days, we lost over 6,000 Nigerians that have migrated due to one reason or the other, some for their own personal benefit, some to gain skills. So people have different reasons for doing that. But this administration is committed to ensure that we retain healthcare providers by providing an enabling working environment, by motivating them. Recently, you will agree with me, and you must have heard it in the news, that His Excellency President Bola Ahmed Tinubu increased even the age of retirement for healthcare providers up to the age of 65. I think this is highly commendable. And this is a very pragmatic way of doing things to ensure that we retain our healthcare workforces. And under the leadership of the Minister of Health, Professor Patti, he has also developed a very laudable and innovative policy on health force migration policy that will help us to ensure that if we effectively implement, to see that we retain healthcare workers, we don't only retain, but also we attract healthcare providers in diaspora. And we have a good agreement with the countries that they are going. Most of the countries they go, they are developed countries, including also the Middle East, apart from US, UK, and Canada. So how do we retain them? I think the policy has clearly spelled out that. So a lot of efforts are ongoing. And in the last 2 years, there has been increased also efforts in the production of healthcare providers. I will take an example with the School of Nursing and Midwifery, which has been upgraded to colleges of nursing and midwifery today. And there is a massive increasement in the enrollment of trainees in those two institutions of training, and also other schools like the School of Health Technology, including also our medical schools. So these are actually steps that have been made in the last 2 years, and we are seeing the successes of that, which is resulting in an increase. So apart from that, a quick measure that was also deployed was capacity building, training of the frontline workers that will work at the primary healthcare facilities, to ensure that there is no break, there is no interruption, so our health providers are available. And there has been massive training in the last 2 years.
Okay.